It's the first day of my surgery rotation. I'm a little lost. So I'm going to give you the rundown of how this rotation has looked so far. So I reached out to his secretary 2 days ago, and she didn't answer the phone, and I was getting a little nervous, and so I emailed her, and then she eventually emailed me back, and she just said, show up at this location at this time. I'm like, okay. So I haven't been in the hospital for a very long time, not since the beginning of my rotation. This is only my second rotation that is inpatient. So I'm like, where do I go? So I just, I had to get a badge, and so I got here just now, went through security, took my temperature, gave me a visitor pass sticker, and then I went to the medical staffing office and picked up a badge. The motivation for the badge was, I thought, because it would help me open doors, because the surgical unit is locked, obviously. But it really doesn't do anything. It's just a badge that says I exist and validates me being here. Maybe. I don't know. So picked up the badge, and then I decided to go on a rendezvous through the hospital to figure out where everything is. And praise the Lord, there was a very nice nurse in the elevator who clearly knew I didn't know what I was doing and asked where I was going. And I said surgery, and he's like, okay, great, I'll show you where it is. So he led me to the surgical unit, and then he opened the door because he has the badge that actually works. And then he took me to the recovery unit and introduced me to some of the nurses, and then that allowed me to ask where to get my scrubs, because you have to change out of the scrubs that you come in to maintain sterility. And then I ran, then I fled, and then I am in my car now. I just did that. Now I have 40 minutes, and I'm going to review anatomy. I don't know any anatomy. I really don't. So I'm going to try and learn something. So, like, at least if I make a guess, it's an educated guess and not based off of my first year knowledge. So, that's all. Bye. Okay. Okay. Is day 3 of my surgery rotation, and I already screwed up. So yesterday I forgot to round. Little background, this is only my second time in a hospital, and I'm almost done with third year. Majority of my rotations have been outpatient, so I honestly forgot rounding was a thing, which is kind of sad, but true. So nevertheless, I know it should have been done, and my mistake. So he was not too happy with me, but it's not going to happen again. So I am getting to the hospital 2.5 hours early before his surgery, because I'm going to know absolutely everything there is to know about his patient going into surgery today for atherectomy. And then I'm going to know absolutely everything that happened last night with his previous surgical patient. Here we go. I'm going to figure out what rounding means. I know what it is. I've looked it up. I did it once before. I'm just praying the nurses are nice to me. Please don't be mean. And if you are, I'm gonna have to find another way to get it, but that's okay too. I just wanted to give an update. So, struggling to navigate hospital and rounding. It's felt a very big lack of purpose because going into each day, I feel like I have zero tools to be helpful. I've had almost no, I'd say the majority, except for one attending who's actually enjoyed teaching. So you put all these things together, and I just feel like I've been going through the motions a lot of these rotations. On one hand, there's no bar being set, it's pretty low. So the day is not very purposeful. I'm kind of floundering around teaching myself things. And then on the other hand, once in a great while, I'll get a preceptor who sets some sort of bar but has no interest in willing to teach how to achieve that bar. And I'm not just saying rounding. So when that happened earlier in the week, when I saw his disappointment and being upset with me, I was, of course, my initial reaction is usually like, oh gosh, like I messed up, I'm so dumb, I'm so this, I'm so that, like. But then later on in the week, I started thinking about it and I started collecting my thoughts, and I'm like, I'm not dumb, and I'm not a slacker. I do work really hard, and I will go above and beyond, even for little things that nobody sees or nobody cares about. It's bizarre that this all came about from just like one comment about me not rounding. It's been brewing though. So, and by the way, like, also when I asked to round, or when after that happened, I'm like, could you please, like, I'm sorry I didn't round, like, won't happen again, obviously. Could you tell me, like, information that you'd like me to get? And that was coming from a place, not that I was trying to make shortcuts and, like, just get to the pertinent information. I just wanted to make sure that if I had a nurse willing to talk to me for a moment, that I'd get everything that he wanted so I could be useful and helpful, because that's kind of my thing right now. I want to do something with a purpose finally, you know, something purposeful medically. So I talked to my friend. She told me, based on my education, based on what I'm paying in tuition, every day that I go in, it's a $500 day. I'm paying $500 to have this experience. And she's like, you're waiting for your school to step up and do the right thing. You're waiting for these attendings to step up and take an interest and want to teach you. And you're constantly waiting. And as you wait, and the more and more you're let down because they don't do those things, you kind of give up mentally. And she's like, you kind of have to take the reins yourself, and you've got to walk into a situation with respect, not doing this anyway with an attitude or a chip on your shoulder or being bitter or jaded, but say that this day isn't about an impressing and attending. This day isn't about making him feel like I'm smart or making him feel like he should give me a good grade. You need to start making this about your learning. So what did that look like? He asked me to go around on his patients Saturday morning for him. And I looked at that morning and I was like, I'm going to go round on your patients, and I have no medical history of them. I don't have any past medical history. I don't have any current medications. I don't even know why they're here. And I can go get that, obviously, but sometimes they don't speak English. Sometimes they're sleeping because I get there early because I'm trying to work my schedule around the nurse's schedule so that they're more willing to talk to me. And these are like critically ill patients. Like, they don't want to give me their medication list. They don't want to give me the rundown of why they're here if they're in excruciating pain. Like, I walked into a gunshot wound and a crush injury. Like, I don't need you to dredge up your surgical history and your family history. So, and certainly they don't want to do that. So I just kind of felt like, at first I felt defeated again. I'm like, okay, I'm going to go do this thing where he expects me to do it, but at the same time, he also knows that I have really it's not going to be anything useful for him because I don't have any, like, what am I going to do? I'm going to get information that he already knows from the chart, basically, and then try and get a little bit of new information if the nurses give me some. So it was just another one of those things where I'm like, the bar is there, but it feels purposeless. What am I really going to be helpful with? Then I remember that conversation with my friend, and I was like, you know what? No. I was like, I'm not going to just do things to do things anymore. I'm not going to do things just to make some preceptor happy. I'm not going to just do things because it's what I just have to do. Like, this needs to be a good learning experience. And I am done with not getting my education worth of a day. I can't keep living like this. And so I woke up early and I basically traveled around the hospital for an hour in the basement, multiple basements, looking for IT. There was no labeled doors. I started pounding on all the doors until somebody answered, and happened to be the IT service guy. It was in a dark room at like 6 o'clock in the morning. He told me they don't see people in person anymore. It's only over the phone because of COVID. And I was like, you know what? I have really tried to find you guys. I need to get this chart access set up. Please help me. Thankfully, he helped me. He set up my information. He got me access to the chart. Not all of it, but most of it. And it was like a huge weight off my shoulder. I was like, okay, finally, I got a huge piece of information that I needed. And then I walked into the room and I did a full physical exam. This was the crush injury patient. And then I went out to go find the nurse because I wanted to make sure I was fully up to date, because the chart doesn't necessarily have every time that they, what all their levels of pain are throughout the night, or what their vital signs are. Of course, same thing happens. I'm trying to talk to her and she just walks away. And then I was like, hey, like, I need you to give me the dimensions of what his hematoma was when he came into the emergency room. I wasn't here initially, and I need to know if it's improving. Second of all, I need to know if his labs are uptrending or downtrending. I need to know what his current medications are, and I need to know why he's on MPO. And it all just kind of like vomited out. And I was like, and I didn't say it mean. Like, right now I'm saying it like this, but I honestly, I just wanted to get her attention and get her to stop walking away. And that was like kind of like a huge switch. And she looks me in the eye, she stops what she's doing, and she gives me everything that I need to know. And I'm like, praise the Lord. Praise the Lord. So, it just felt so good. I'm like, I feel like I finally did something, you know, like, I talked to a patient who hasn't seen, who's been waiting to see if he needs surgery, because there's a possibility that he has compartment syndrome. There's a possibility that he has no arterial blood flow going throughout his arm, which means that he could have an ischemic limb. So he has no idea what's going on. The surgeon hasn't talked to him or come in to see him yet. He sent me to do it. And so this guy's sitting here in the room, like, basically waiting, like, am I going to lose my arm? Like, what's going on? And he was on NPO that was ordered the day previously. So in his mind, he's thinking, like, surgery is going to happen. Why else would he be on NPO? And apparently the residents put him on that, and they were expecting that he might be going into surgery. And then I'm looked at his imaging and I'm like, no, he doesn't, like, there's nothing to suggest that he should be going into surgery. Like, there's a hematoma, but that's about it. Like, he's able to move all of his extremities. He's able to use it against resistance. He has no loss of sensation to touch. He has good capillary refill. I can feel his pulses. And, yeah, so I told the nurse, I was like, why is he on MPO? And she's like, actually, I would really like to know that as well. Can you please ask the surgeon? I told the surgeon, I'm like, I don't know why he's on MPO. Were you planning to do surgery? And like, I just didn't know about it. And he's like, no, he shouldn't be on MPO. Like, take him off of it. He's fine. He doesn't need one right now. So I went back to the patient. I was able to tell him, like, you're good. You're okay for right now. We're just monitoring it. And I'm going to have the nurse take you off NPO. I told her that. She was happy to have some direction. Such a small thing. And by no means did I do something substantial. And that's not what I'm saying. It was just so nice to just do something. And it was like, nobody expected that, right? Like, he didn't expect me to go above and beyond to get chart access because he isn't willing to put in that effort. The nurses weren't expectant of me having any useful information or doing anything for them. The patient didn't even know who I was. Like, he still probably has no idea who I was. So it's like, it was just nice to take initiative and to start caring about my education purely for bettering myself as a future doctor and trying to help a patient. No more. Like, if you're not going to do it, if you're not going to help me do it at all, then I'm just going to do it. And it's really helped also my confidence level, because I'm always like, oh, like, can I ask this question? Like, what if it's dumb, or what if he's busy? And now I'm just like, no, like, I need to know this. And if it's a dumb question, I'm sorry, but I want to know what it is. It doesn't take a lot of effort to answer a question. If it's something I can look up, then I will look it up. But this is also part of the experience. Part of the experience is you teaching me. And if you're not going to, I'm going to ask questions. And if you don't like it, I'm sorry. But, like, what do you want me to do? I will still be helpful in any way that you want. I will go print papers for you. Like, I'll go fetch things for you. Like, I'll still be, like, respectful and do things for you, even though you're not holding up your end of the bargain. But my perspective is changing, and it's no longer going to be about, do you like me and are you going to pass me?